The threat of strike still looms over the UK's National Health Service, the NHS, while junior doctors in England are set to stage 3 days of strikes this week, and experts predict almost all routine NHS services in England will get disrupted as a result. Well, thousands of junior doctors are due to stage a 72-hour walkout from Wednesday. In April, when the junior doctors conducted a 4-day strike, about 27,000 junior doctors stayed off work every day, and more than 190,000 outpatient appointments and operations were postponed. Well, they are demanding a 35% salary rise. Health Secretary Steve Barclay says their claim is unreasonable. The Junior Doctors Committee of British Medical Association is expected to hold balance for further strike action. The union plans to stage a 3-day stoppage every month. Well, for long, NHS has been dealing with industrial action by nurses, ambulance staff and junior doctors. Across the NHS, more than 542,000 consultations and surgical procedures have been rescheduled. For more on this, Alex Izad is joining us live from London. Alex, here we go again.
You're not wrong. Yes, from tomorrow we will be seeing this 72-hour walkout by junior doctors. Now, we keep hearing that it's going to be disastrous and there's going to be real problems tomorrow and ongoing with regards to these junior doctors' walkout. And Steve Powers, who has been the union head, has been saying that this is a real issue that needs to be resolved. But let's face facts. This is a bit of a scare tactic as well. They want a 35% pay increase, and even from the beginning, which is now nearly 8 months previous, Health Secretary Steve Barclay says that is unobtainable, and unfortunately the unions won't come to the table and negotiate. So there really is this sticking place here with regards to money. But when it comes to operations and pushing back and people who just want to get into the hospitals and get some of their routine operations done. Now, this problem is not new, and this is not because of strikes. There has been this huge backlog from before even COVID times. COVID obviously put a huge pressure on the NHS, and it does seem to be cracking under the weight of people continually waiting, and then another strike happens. But it's not fair to blame those that are striking, because, as I said, this has been a long time coming. A lot of people who wanted to get those operations, they've been scheduled. They're saying they're not as important, they're not emergencies, and they keep being pushed back and pushed back. And we constantly hear from people who are on waiting lists for over 3 years. Now, we did hear last year that there was a reduction in the 2-year waiting list, but those who are waiting longer or even 2 years is just not really very fair if you're wanting to have that operation, whether or not the NHS deems it an emergency. So this 3-day strike, we were out on the protest a few months ago, really, with the junior doctors, and we saw there wasn't that many of them actually protesting, because it is in their contract that if the hospital does say that they are needed, that they will go to work. And many of the junior doctors have told me that they don't want to be on the picket lines, they don't want to be striking, they want to help and move forward. And both the Health Secretary, the government and the unions need to come to the table to start these negotiations moving, because the ones that are missing out are not the junior doctors themselves, but are the patients, the people of the UK, and they're the ones that continuously keep missing out, and the NHS is not reaching the targets, and it's not unfair to blame those that are on strike.
Yeah, quite right. Those poor patients that are waiting for those operations. I feel terribly sorry for those people, and obviously there's sympathy for those people striking as well. It's a difficult one. And thank you so much indeed. That's Alex Izad there talking about junior doctors in England set to stage a 3-day strike this week.